So most ladies who have a pregnancy affected by gestational diabetes will have a healthy pregnancy and baby, but we do know that there are some increased complications for both mums and babies. For mums, it can increase the chances of them needing an induction of labour or a caesarean delivery, and that's usually due to babies being bigger than we would usually expect. It also has long-term health implications and increases the risk of developing diabetes later on in life, so we would recommend annual surveillance for diabetes. For babies, there's an increased risk, as I said, babies being larger than usual because of the diabetes and the high glucose levels. It can also mean then following delivery, babies can have low blood sugars, which may mean that they have to be admitted to the special care unit for slightly closer monitoring. Later on in life, it also puts them at slightly higher risk of developing complications such as diabetes themselves and obesity. We can help to reduce these risks by closely monitoring mums and pregnancies during the pregnancy, and ensuring good blood sugar control will help to reduce these risks. So early on in pregnancy, every lady undergoes a risk assessment for fetal growth restriction. Those ladies who are identified as low risk will undergo what we call symphysio-fundal height measurements with their midwife, which is where they measure from the top of the womb to the pubic bone. If there's any concerns, then they would be referred for a scan. And then those ladies who are identified early on as high risk will undergo ultrasound scan surveillance. And it's by using scans looking at the baby's estimated fetal weight and their blood flow studies that helps us identify those babies that are growth restricted, so smaller than we would expect. Once we've identified that the baby is smaller than we would expect, monitoring strategies include continuing to monitor the baby's growth and optimal timing of the delivery. So scan frequency might be increased, and what we are assessing is the weight of the baby, the blood flow through the umbilical cord, and the fluid around the baby. And by working within a multidisciplinary team, then we aim to optimise timing of delivery. For some babies, when the growth restriction is very severe, this may result in an early delivery. Otherwise, delivery will depend on the size and the scan assessment of the baby. Pre-eclampsia is a pregnancy-specific condition that can affect about 1 in 10 ladies. We know that there's some groups of ladies that are higher risk of developing pre-eclampsia, such as those ladies with pre-existing medical conditions, such as blood pressure or diabetes, those women who have got chronic kidney disease, women who've got multiple pregnancy or have had a previous history of pre-eclampsia. So we do a risk assessment, and we can recommend low-dose aspirin for these ladies to help prevent pre-eclampsia. Unfortunately, there's currently no cure or treatment for pre-eclampsia, and the main monitoring strategies are making sure we've got a well mum and well baby, and weighing up the risks and benefits of continuing the pregnancy, because the only way to treat pre-eclampsia currently is by delivery. So complications that mums could face who have a diagnosis of pre-eclampsia are things such as swelling, predominantly in the hands and face. Their blood pressure increases. Their kidneys can become a little bit more leaky of protein, so we notice protein in the urine. And for the babies, it can affect the way that the placenta receives the blood flow, which can have an impact on baby's growth. So we monitor ladies closely once we have recognised that they have pre-eclampsia, keeping an eye on key things such as the blood pressure, the urine, mum's bloods, and the baby by scans. And again, we work in a multidisciplinary team to ensure that we optimise the timing of delivery to improve both the maternal and fetal health. As the lady's age increases, then the risk of most of the pregnancy complications does start to increase. So even before pregnancy, ladies may notice difficulties getting pregnant as fertility does reduce with age. And then there's a slightly higher risk of ladies having a miscarriage or a pregnancy loss. Sometimes this is due to underlying chromosomal or genetic conditions that we do know increases with maternal age. And then other complications that they may encounter are increased risk of blood pressure complications or diabetes. For the baby, there's a slightly higher risk of them being smaller than we would expect, or having to be born a little bit early due to complications, or sometimes ladies who are slightly older go into labour naturally a little bit earlier. There's also a slightly higher risk of needing a delivery via a caesarean section and losing a little bit more blood at the time of delivery. There's lots of risks, but we know to look out for them, and by having good prenatal counselling, we can help to optimise maternal condition before, so we can ensure that blood pressure, if there's blood pressure issues, then we can optimise medication, ensure any medication is safe to continue throughout the pregnancy. We can ensure that any investigations that would be required before are performed to ensure we're fully informed before we embark on a pregnancy. We'd recommend, as for any lady, taking folic acid and vitamin D. And then we would recommend that ladies of advanced maternal age are seen in a consultant-led clinic. Going forward, they would have an individualised plan of care, taking into account any previous medical history and acknowledging the risk factors for the pregnancy. And by having regular appointments, we can ensure that we help to improve the outcomes for both mum and baby. So one of the most recent advances in prenatal diagnosis is the availability of non-invasive prenatal testing, which is available currently privately, and for those ladies who are detected as high risk of one of the common chromosomal conditions during their first trimester screening. This test is a blood test where it looks at cell-free fetal DNA, and it's a highly accurate screening test. It's important to remember, though, it is just a screening test, and that we would recommend a confirmatory diagnostic test should there be concerns raised from the test. Another area is extensive genetic testing for ladies who may require an invasive test during pregnancy. We now have the availability of performing some extended genetic testing in certain conditions. And by having the availability of these tests and gathering information earlier on in a pregnancy, it helps patients to understand and to enable them to make more informed decisions with their pregnancy. Also, having access to diagnosis earlier on in pregnancy allows us to develop individualised care plans and ensure that appropriate management plans are put in place. It's important, though, that these come with support and counselling, because they can raise ethical dilemmas, and it's important that there is the support there for the patients.